So let's get started. This is reopening during COVID-19. What is next? My name is Valda Crowder. I'm an emergency medicine physician, and I also do some medical consulting. People call me Dr. V. So you, on each slide, you'll have all of my information at the bottom of the slide. At the website, which is AskDrV.us, you will see the original source articles for the research and the content that I'm actually speaking of. So you will not see the source documentation on the slide because it gets too crowded. I've been practicing emergency medicine now for 30 years. This is now my 4th pandemic. I've also treated people in a mass shooting and also in a hurricane, in a Category 5 hurricane. And so I like to do things for the community around what we actually need to do in times that are stressors such as this. The slide presentation will be 10 to 15 minutes, and then it'll be followed by Q&A. Usually we're done within an hour. The presentation is essentially the same from week to week. I do Tuesdays and Thursdays unless I'm actually working in the emergency department. And we update the slides based upon what's actually going on in the news or in with research that has come on board since the last presentation. During the presentation, everyone is in listen mode. You can ask questions through the chat icon, or you can also type in questions through the Q&A. And then when we come off of the slide presentation, we will first go down the questions on the Q&A and in the chat. We will open it up for people to ask questions depending upon the number of people and the time. The intention of the webinar is to keep all participants informed about COVID-19 science, so it will help them and their families stay healthy during this pandemic. The outcome is that you will leave the webinar motivated to create an action plan for you and your family around reopening, and create an action plan for your broader community. So a little bit about COVID-19. This is basically a disease of people and surfaces. So the disease spreads from person to person, from small droplets in your nose and mouth that people either pick up on surfaces or they breathe in. It's highly contagious. It takes 45 seconds of exposure to become infected. It has a penetration rate of 60 to 80%, which means if 100 people come in contact with it, 60 to 80 of them will actually get the disease. If you look at something like influenza, influenza has a 20 to 30% penetration rate. Minimum number of droplets is 1,000 droplets to actually become infected with COVID-19. There's a lot of science around viral load. So if somebody has a higher viral load, that means that maybe they got exposed to 10,000 droplets as opposed to 1,000. The droplets stay on surfaces for a very long time. Cardboard surfaces for 24 hours, plastic surfaces for 96 hours, metal surfaces for days. So when you actually look at someone coughing or sneezing, you can see that it can then spread in a lot of different areas. And along this 3 feet and 6 feet, there are objects. There might be a public bench or a public chair or a computer or a countertop or a chair. And these are all surfaces that you can then later on come back around in that 24 to 96 hours and become exposed to. So let's take a look at the risk, okay? A toilet being flushed without a closed seat releases 8,000 droplets into the air. A cough is 3,000 droplets at 50 miles per hour. A sneeze is 30,000 droplets at 200 miles per hour. A breath is 50 to 5,000 droplets. And speaking, depending upon the voice, and someone speaking louder is actually releasing more droplets. But 5 minutes of speaking face to face is the required dose of 1,000 droplets to actually become infected. So this is why it's very, very important that you wear a mask for yourself as well as wear a mask for others. Transmission rate. Transmission rate is what we call the R number. We call it R naught. I have not heard anyone say what the transmission rate is in the US. Worldwide, COVID-19 is 5.7. The Spanish flu in 1918, which people talk about a lot, that had a transmission rate of 1.4 to 2.8. So as you can see, this is a really, really high transmission rate infection. Germany has set the R naught for less than 1, and that is what they're using as a criteria for reopening. I think for us, it's very dangerous because no one is saying what the R naught is. And so I believe that it's probably much, much, much more than 1, probably much, much more than 5, and we're going back to work. Proper hand washing. There's a lot of stuff around proper hand washing. I always put in this slide because I think it's important. Most people do the palm to palm hand washing, which is slide 1. But it's very important to do 2 in between the fingers, 3, which is the back of the hand, 4, which is the base of the thumbs, 5, which is the back of the fingers, 6, which is underneath the fingernails, 7, which is the wrist, and then 8, which is rinse and dry. This slide here shows what happens when you don't do proper hand washing. So slide 1 is the dirty hand, and the hand gets darker as it gets cleaner. So if you rinse the hand with water and just shake it, you see you don't really do that much. 6 seconds of washing with no soap is slide 3. 6 seconds with soap is significantly better in 4. 15 seconds with soap is slide 5. And 6 seconds of slide 6 is 30 seconds with soap. So the recommendation right now is 20 seconds with soap, which would be in between slide 5 and slide 6. The power of social distancing. The way we were living before, 1 person would infect 406 people in 30 days. When you do the lockdowns, you have 75% less exposure, and 1 person then infects 2.5 people in 30 days. So when we go over the symptoms, we've talked a lot about this on our presentations. You don't have to have any symptoms. You can be completely asymptomatic. One of the earliest symptoms is loss of taste or smell. Sometimes people have a decreased appetite, nausea, vomiting, diarrhea. We are now seeing blood clotting, which is a clot in the legs, a clot in the lungs, or stroke. This is how come most people are mislabeled and maybe labeled as not as COVID related because somebody thinks they just had a stroke. Then the other thing is the respiratory symptoms that people talk about: headache, fever, dry cough, difficulty breathing. Then there's also COVID toes, which we particularly see in young people. And this is just a picture of what it actually looks like. Kind of like a reddish bluish discoloration of the toes. It's usually fairly asymptomatic. Maybe if there's some swelling, people may have some pain related to the swelling, but it's not particularly painful. It is alarming to people, so they bring themselves or their kids in related to it. Asymptomatic transmission rate is about 50%. We've seen this now in a variety of settings. Cook County Jail, the Theodore Roosevelt in the Navy. Iceland also saw 50% of corona cases have no symptoms, and we also saw it in Rouen, Italy. So that's been fairly consistent, and that's fairly troubling in that we have to actually test asymptomatic people. We have to test people that do not have symptoms to get a handle on this virus. Risk factors: anyone born before 1955. And I think that's a very important criteria to think about rather than the elderly, because none of us think we're elderly, even though we might be born around that time. So born or on before 1955, living in a nursing home or long-term facility, any sort of asthma, COPD, emphysema, heart disease, immunocompromised, which could be cancer treatment, but it also could be HIV, lupus, rheumatoid arthritis, sarcoidosis, or someone who's at a transplant. People who are pregnant are also predisposed. And the other thing that a lot of people are not talking about, which we're seeing clinically a lot, is severe obesity as a risk factor at any age. In Japan, they've actually had 2 sumo wrestlers in their 20s die. And that is defined as a BMI over 40. So a BMI over 40 is these height and weight criteria: 5'2" over 220, 5'6" over 250, 5'10" over 280, 6 feet over 300. And that is a BMI over 40. And those people are, again, they're at risk at any age. Men are more likely to get this infection. There's something about them that they have a protein or something on the surface of their blood that allows this to attach and get in more readily than women. They're also more likely to die from it. People with a blood type A are more vulnerable. People with a blood type O seem to be protected. Again, this seems to be related to the proteins that are on the surface of the cells. Anybody smoking or vaping is more likely to get the disease. We're seeing a 40% of our patients that are hospitalized are between 20 and 54. So what's next? It's very important that we risk stratify activities. High risk activities, public transportation, airline travel, going to the restaurants or movies, any place that's enclosed, gambling, going to a work cafeteria or break room. Medium activities would be ride share, pickup, takeout, grocery shopping. Low risk activity would be walking, biking, going to the park, having your food delivered, Zoom meetings, conference calls, bringing your lunch or snacks to work and then sitting outside and eating them. So it's very important that employees and jobs risk stratify as we open up. So there's certain high risk jobs, manufacturing, armed services where you live in close quarters, particularly the Navy. Any public-facing business, restaurants, hair, nail, salons, transportation, hotel, airlines. As you see these areas opening up, these high-risk businesses, one thing you should look at is you don't see the doctor's offices reopening, okay? So I tell people, you know, be very wary. If you can't go to your doctor's office, you probably should not be going to get your hair done. Medium risk jobs or office work, depending upon how the office is laid out. Low risk jobs obviously would be parks, recreation, landscaping, and construction. A lot of folks have wondered, you know, do they need PPE? And a little bit about PPE. These are the masks and the medical gloves and everything that people use. It's very important that people actually know how to use PPE because you can actually contaminate yourself by not taking off your gloves correctly or not taking off your mask correctly. But this is actually what PPE actually looks like. Questions to ask your employer. Can I work remotely? If you feel like you are working in an environment where you need to work remotely and you're not being allowed to, you should consider getting a doctor's note if you feel like you have risk factors. What sort of PPE will I receive when I go to work? You should ask that before you get there. Can I get tested for COVID-19 at work? If I can't get tested at work, how do I get tested? Where are my testing sites in my community? If I get sick, do I have sick leave? Do I have access to telemedicine services? Does my company allow me 14 days paid sick leave if I need to be quarantined? Sometimes what they will say is, well, we allow 14 days sick leave if you get a COVID test, but then it's difficult, it's almost impossible to get a COVID test. A more responsible employer would say, you can't come back to work unless you have a COVID negative test. And then, you know, you have to go in and actually get a prescription and get some, and get passed and cleared. So a couple of things from the May 12th hearing with Dr. Fauci, and I'll add even a couple of things from the hearing today. He cites serious consequences if places open too quickly. There's a deadline that has been set for a testing plan to be released to the public by May 24th. They also said that a vaccine will not be ready in time for the new school year. And they're also ramping up and hiring contact tracers because we previously did not have the infrastructure to really properly monitor the virus. So we're now nationwide actually hiring contact tracers and beginning the work of actually tracing this virus and those that are exposed. This is all of my basic information and sort of how to get in contact with me. I have some communities, sororities, and Chamber of Commerces that are asking me to do specific presentations for them. So you can just send me a note there or reach out to me, and these are the ways to actually reach out to me. I know there's got to be a lot of questions because a lot of things have happened since we last talked. And Holly, I'm going to turn it back over to you.
All right. Well, we do have a healthy set of questions in the queue. I want to remind people that this information, we put this on so that we can provide you with quality information and answer your questions. I encourage you to use the Q&A at the bottom of your screen to ask questions, and we will go through the questions that we have. That's to make sure that we get everyone in. And then if you have other comments, you can feel free to use the chat. So we'll get started with the questions and we'll just continue to take questions. So there's still time to get your question. Just simply add it to that Q&A box. But for right now, I think we're good. Let's get started.
Oh, yeah.
Okay. First up, transportation question. If renting a car, do we need to worry about the vents? Should I run the AC for a few minutes before entering or what?
Yes, I would run the vents for a little while. But more importantly, what I would probably do is I would spray. It's important to spray, not to wipe. So I would get like an all surface cleaner and I would spray the steering wheel, the handle on the outside of the door, the handle on the inside of the door, as well as the gear shift. And wherever I turn on the lights, I would spray all of those things that I would normally touch. I think that would actually be, you should actually turn the vent on for a little while and let the car, let the air recirculate. Normally, in a car, they're actually bringing the air from the outside, which is actually good, and bringing it through a venting system and circulating it on the inside. So the main thing, though, is I would spray down the surfaces.
Awesome, thank you. We're going to go to our next question. If the dental offices have appropriate PPE, would you feel comfortable or recommend treatment? We get a lot of questions about dentists.
I know. Well, let me just say this. I will just say this is that I actually have something I need to go to the dentist and get handled. So I have right before this all happened, I had a tooth abscess. And so they wanted me to be on antibiotics for 2 weeks, and then they were going to go in and drain it and do everything. I have not yet had the courage yet to go back to the dentist myself. I know that several of the dentists actually closed down for emergency procedures only. I contacted them and I asked them whether or not my tooth abscess would be considered emergency service, and they said no. The issue with the dentist is actually is that the dentist has to get so close to you to actually do the work on your face. So not only do they have to have PPE, but you have to have PPE. But then they still have to get access to your mouth. So when I work in medicine, like the highest possible, the riskiest thing you can do is intubate or put somebody on a ventilator where you're actually in their mouth. So I would not go to a dentist yet, even with PPE. And I haven't gone for myself.
I need to go too. I need a good cleaning though, but I guess I'm gonna hold out.
Yeah, I'm like this. I'm holding out for the abscess. I know you need to hold out for cleaning.
Do you know anything about the P&G product Microbond? It is not on the EPA list, but the label states that it kills human coronavirus. This is Microbond. I may be Microban, MICROBAN.
So here's what I do know is on
my Microband, she's saying.
Microband. Okay. So on my website, I have a link to the EPA website, which has over 400 cleaners that actually kill coronavirus. I know a lot of people were scrambling and wanted to get Clorox. If I were you, I would check and see if it's there. There's 400 cleaners that kill coronavirus, and it tells you how long the cleaner has to be on the surface before it cleans coronavirus. And I would see if it's there.
How safe is it to travel on an airplane wearing a mask?
Yeah, so I'm not doing that either. So here's the thing is right now, so when you're on an airplane, that is recirculated air. So 90% of the coronavirus infections and deaths are related to being inside an area that has recirculated air, whether or not that's a nursing home, an airplane, a casino, a church, any place that's where you're inside with a lot of people. So there's a couple of things is that airlines have said that everyone has to wear a mask to get on the plane. But they've said that the people don't have to keep the mask on once they're on the plane. Only United has said if the plane is too full and you're uncomfortable, you don't have to get on it, and you'll get your money back. Other airlines are canceling flights, and they're filling up these flights more and more. So I would not necessarily. I'm not going to do any airline travel for the rest of this year for myself. They did change their cleaning policy, so they're cleaning the planes more frequently. And they also upgraded, most of them have upgraded to the charcoal filter for the circulating air. However, like I was saying on the presentation, the particles from one sneeze or one cough move so quickly that is not. I don't think it's sufficient.
Okay. We'll go to the next question. My friend's mother is 70 and lives in an apartment building. She's concerned for her health and has not walked outside in 2 months. How can she safely go for a walk? She's on the 8th floor.
Yeah, so the best thing to do if you want to safely go for a walk is to go very early in the morning. So to go like 6:30, 7 a.m. in the morning. There's a couple things that I'm noticing even when I work in the emergency department is that people are sleeping in a little bit longer. If you notice, like most of us are now getting up later in the morning than we normally do. So if you go for a walk at 6:30, 7, even 7:30, 8 o'clock in the morning, there's really nobody out. So the best thing for her to do is actually go early in the morning. Do a little 30-minute walk in the morning. It'll keep you pepped up and energized for the rest of the day.
All righty. Now that states are starting to allow outside dining, is this safe? If they're using non-reusable menus, and how long can I sit outside and eat? And do I need to worry about how far away someone is? So she's using the non-reusable menus, I guess, as an example. Okay, that's
right. So one is if I was dining outside, I probably wouldn't have them bring me a menu at all. I probably would decide what I wanted to order before I got there from my phone, right? But yes, because you don't really know, did they really use the menu on anybody else before? I just wouldn't take any chances. Most restaurants, you can get the menu on your phone and you can decide what you want to order. I definitely would not feel safe being inside of a restaurant, outside of a restaurant, sitting out on a patio or something. I would feel a little bit better, but I would still make sure that I am 6 feet away. If you're dining with someone, you're kind of almost better being like catty corner rather than face to face across a table. Like if there's a table of 4 seats, then, if someone sits on the inside and then you sit on the outside, so you're not directly face to face to that person, that actually makes a difference as well. But let me just say this. Why not take it to go and go to the park?
I love the options. That's the best thing. Just take it everywhere.
Just take it to the park.
Just be mobile with it. Enjoy
Yeah.
some sights.
Exactly.
Would it be safe for a group of friends when permitted by their state to sit around a fire, for example, or at a park and share drinks from 6 feet apart if we are having drinks and then wouldn't be wearing masks?
So no, I would wear a mask. No,
Okay.
so this is what I think is important. So the washing hands 6 feet apart and the mask are to be used in conjunction with each other, right? Some people are like, well, if I wash my hands and I shouldn't have to do this. No, it's all together, right? Wear a mask 6 feet apart, and you want to actually wash your hands 6 feet apart and wear a mask. The only time that I would not wear a mask is if I was going to go for a walk at 6:30, 7 o'clock in the morning. I was going to be all by myself. I was going to be out at a time where it's so early in the morning, no one else is out. That's about the only time I wouldn't wear a mask.
Okay. Let's see. When and how can I hug my mom? I gave her a hug with mask on and was very quick, though I'm staying up for another 2 months or so. Come on.
I
When can
know.
hug my mom? Everybody wants to hug their mom. I want to hug my mom too.
I want to hug my mom too. I want to hug my mom too. It's funny because so I have, when I did the slide with the PPE, I have the Tyvek suit. I would hug my mom if she had on a Tyvek suit, a face shield. I had on a Tyvek suit, a face shield. Yeah, it's just, I know it's hard. I know it's really, really hard. But I want people to really remember that, like, our goal is to really stay alive until there's some treatment for this, whether or not it's plasma therapy or remdesivir or a vaccine. Our goal is to really stay alive. And even though we really, really, really want to hug our family members, we have to wait.
Okay. So I'm going to go back just a bit. There's a little guidance from Janea. I hope I've said that right. I've been practicing. And she says that the microband from Procter & Gamble, that's what the P&G stands for. Thank you for that. I have to learn not to use acronyms. Is being advertised on TV and supposed to be 24 hours of killing virus or whatever. So we hope that that's true if people are using it. And then a quick follow-up to the apartment building question. Is the woman's concern to get from her door to the outside requiring going downstairs or elevator and then through the lobby and opening the doors? That's where she's fearful.
Yeah. So, okay, yes. So I would absolutely wear a glove. So what I normally do is I have one gloved hand and I have one ungloved hand, right? So the gloved hand is for dirty use, opening up something, reaching for something. The ungloved hand is usually for my phone because my phone is clean, right? So I have a dirty hand and a clean hand, right? That's what I normally do. You could actually go down with 2 gloves, right? And then once you get downstairs, you can take your gloves off. And then before you go, when I go for a walk, I've got gloves in my pocket. I put my gloves back on and then I head back up. So absolutely she should be gloved, right? Because you don't want to touch, like, for instance, if you're walking down steps or you're punching the elevator buttons. Some people, rather than being gloved, what they do is they carry like a pen or a Q-tip or a stick or something where they can punch things without actually touching it. And then they throw that Q-tip or thing away.
Okay, we're going to go to, you just have to think about everything now, don't you?
You have to think about everything. Yeah, you really do. Yeah.
Can an employer insist that an employee have COVID testing if they report that their spouse is COVID positive and they recently traveled to another hotspot and they are asymptomatic. We are concerned about coworkers.
Yeah, so it's interesting. What I'm actually seeing most employers do, most employers are not requiring something without symptoms. But most of them are saying you cannot get 2 weeks off unless you come in with a COVID positive test, as opposed to, hey, something happened that is high risk, which is what you're referring to, and maybe you should get tested. Most employers are looking for, they don't want to test you because, one, they'll have to replace you and replace your hours. They also don't want to give you 2 weeks paid leave. So I find that employers are actually operating in a manner that I think is a bit irresponsible, right? For public health, for their own financial concerns.
Mm-hmm. And then we got a clarification on the microban. I appreciate you all keeping us up to date on that.
Okay.
That says, although microban is advertising that their product kills viruses and human coronavirus, it is not listed on the EPA list.
There we
So
go. There we go.
And we definitely, at this point, the more official, the better.
Yeah.
All right.
There's 400 products on the EPA list. When you go to that EPA list, and like I said, the link is on my website, those 400 products you can get on Amazon. You can get them on Amazon or eBay. So stick with the ones that are on the list.
Mm-hmm. Don't be fooled by marketing alone, right? Check your facts.
Yeah, check your facts. Check your facts.
Is there anything we need to do differently at home if we get sick? For example, not laying in bed all day, or laying on our stomach, or anything like that.
Yeah. So the main thing is, if you get sick, you want to take things like Tylenol for your fever, right? You don't want to take Motrin or Naproxen. Those are nonsteroidals, can make the disease, make it worse. You also, this seems to be something where people do better when they sweat it out. So people are, drinking tea, getting underneath the covers and kind of sweating it out. That seems to work better. When people have difficulty breathing, they're actually doing better on their stomach or their side. You want to make sure that you quarantine, which means staying in your room and do not come out. Have people bring food, set your food at the door. If you have a private bathroom, that would be best, or a bathroom that no one else uses, because again, it's droplets and surfaces. For a full 14 days, they have found that some people are still shedding the virus after 14 days. So if you have somebody who's high risk in your house, you actually want to do it for 21.
Okay. So one of the questions is around whether you have the same concerns for riding trains. Are trains the same as planes? We talked about planes. What about trains?
Yes. Planes, trains, and anything that is public transportation. Yes, because again, a train is metal surfaces, and other people have been on there. So I was watching, and I do like Governor Cuomo. So, but I tell you what, he said, well, what we're doing right now is we're gonna wash the trains once a day. And I was thinking, ugh, that means you weren't washing them once a day before? Once a day is inadequate. Personally, they need to run that train in one direction, wash it, and then run it back in the other direction, spray it and wash it, and run it back in the other direction, spray it and wash it, so it gets washed multiple times a day. I would not be on any sort of metro, train, or plane. If I had to actually get on a plane, I would be in a full Tyvek hazmat suit.
Oh, wow. Dr. V, please talk again about when to go to the emergency room if you have other symptoms not usually associated with COVID. I'm very interested in this question myself, so thank you for asking. I had an employee who thinks he has food poisoning, and I was like, please don't go to the hospital. Please call somebody. But what do you recommend?
Yeah.
Because I'm not the doctor. Maybe I should have just called you and asked.
Right. I would try everything before I would go to the emergency department. So if I thought I had food poisoning, I would go to the emergency department if I was vomiting and after 2 days. Do you know what I mean? I would, if I felt like I was dehydrated, I would, abdominal pain that I really couldn't contain, you know what I mean? That lasted a long time. The younger I am, the more I would, if you're young, you can vomit for a very long time and have diarrhea for a very long time and be fine. If you're older, then, hey, maybe if it's been going on a day, you need to go in. But you really want to make sure that when you go in, that this is something that, as I tell people, is this worth possibly getting COVID-19 because you went in there? Is it that bad? So all of the folks that, stubbed their toes, sprained their ankle, those folks absolutely need to stay at home.
All right. So this is another one. What are your thoughts about church services? When can we go back to church? We're missing the congregation.
Yep. So, I didn't put it up there, but on the slide about how many droplets as actually goes in the air. The other thing that causes a lot of droplets is singing.
That's terrible.
Absolutely not go to a church that had any singing or choir, or we're gonna, repeat this, we're gonna say this all together, all of those things. No, for this entire year. All of that, right? If I thought that I was going to go to a church service and we were going to be able to be 6 feet apart and it was going to be less than 10 people and we could be outdoors.
All right. Well, there it is.
Yeah.
Pass that to your pastor and see what he can work out. That's what we'll do.
Yeah.
He has some guidance now.
Yeah, my church is doing church service on Zoom. And we're actually, I have to say, it's actually worked out really well.
Mm-hmm. Yep. All right. So, we're worried about going to the dentist. I'm getting a lot of dentist questions, but I'm going to combine 2 questions here because they're very similar and ask about dentist and doctor's office. Like, what are the parameters around being able to go to the office? What are some things we should look for? How much longer should we wait? Because there's other medical things happening. So
first of all, your dentist or your doctor is more scared of you than you are of them. Okay. All right. So the general public has a higher infection rate than healthcare providers. So the general public has about 2 times the infection rate by antibody testings in New York than medical providers. So we are more concerned about you, most likely, than you are about us. And most physicians and dentists are going to be taking a lot of precautions. I would say that when you start, just, most of them will do temperature testing. I have a cousin of mine, he tried to go to his doctor. He had a temperature of like 99.6 and he wouldn't let him in. So a lot of them will be doing temperature and symptom screening. And many of them are just not going to open up until this gets a little bit further along. So, I would say that, you should definitely see your doctor in, wearing a mask. His office staff should be wearing a mask. You may see that they decide to do telemedicine. They do some telemedicine appointments. If you've just got to maybe get your blood pressure medication renewed or something like that, they may do a telemedicine appointment to limit the contact with you.
Okay. All right, so back on travel. I'm ready to travel myself. So.
I'm ready to travel too. I miss it.
If you have to travel, besides disinfecting the surfaces, now we're going to talk about what should we be doing in a hotel room.
Oh, okay. So let me tell you what I do in a hotel room, because I actually, so I travel when I work, but I don't get on planes. I drive, right? So, but let me tell you what I do when I get to the hotel room. So I usually bring a spray bottle of cleanser. That's like an all-surface cleaner that's on the EPA website. I have my gloves. I open up the door. Well, first of all, when you go check in now, you know, you check in and they have you so that you're like 6 feet apart, right? And the card thing is very out there near you. So you put the card in and then you get your room key and all of that. So the first thing I do is I spray down my room key. Okay. So then when I go to the door to open up my room, I spray the outside door handle. I spray the inside door handle. When I go into the room, I immediately spray down all the light switches, the handles to the toilet, the handles to the sink. I also spray down the remote control. I spray all of those surfaces down. Most of the hotels are not doing cleaning services, so there's no one coming in to clean your room on a daily basis. And so that's usually good with me because I don't want anybody to come in. Once I clean, so I go in and I immediately clean all my surfaces. Oh, the other thing I clean is the thermostat because I'm constantly getting hot or cold. I'm turning it up, I'm turning it down. So I clean, that's a button surface that I actually clean. And then I will go in and out and won't think that much of it, but I always wear a glove when I use the outside door. The outside door coming into the hotel or the outside door coming into my room.
So we're on cleaning, so let's stay there for a second. Just like cleaning public transportation, shouldn't the restrooms at restaurants be cleaned every time it's used? What about public bathrooms?
Yeah, so I actually was laughing with a friend of mine because I drove to New Hampshire and then I drove back to Washington, D.C. And I said, you know, I worked for a week and didn't catch COVID-19, and I think I'm going to catch COVID-19 in this New Jersey restroom. Right? So,
Right.
yeah, the restrooms are particularly, the public restrooms are problematic. I go into so first of all, what I do is I actually, I specifically try to go to a place where I think they clean it more frequently, like a McDonald's or a Wawa, as opposed to a little small gas station where maybe the, you know, bathroom's over on the side of the building or something. So I try to go to places where I think they might have a cleaner bathroom, and I do go in fully gloved. Depending upon, because sometimes the sinks in these bathrooms look really terrible, I bring in my hand sanitizer so that I may not have to actually interface with their sink if it looks particularly dirty. But no, the public bathrooms are problematic and they are not cleaning them like they should.
Yeah, so avoid if possible sounds
Avoid
like a good
if possible. Avoid if possible.
Yeah.
Like the thought, I have had the thought of wearing a diaper up to New Hampshire.
Oh,
I've had the
no.
thought, like, could I just not have to actually, you know, but yeah, what I've been doing is I've been going to Wawa's or McDonald's where it looks like it's, you know, or I'll do something on the New Jersey Turnpike, you know what I mean? And I've been managing it by just the type of place that I stop at and go to the restroom.
Okay. Should a bearded man cut his hair
Absolutely.
so that okay.
Absolutely. 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 Yeah, I had a facial hair slide. I took it out because everybody was like, your presentation's too long. I said, okay. But no, absolutely. So we are recommending in the any hospital worker cut their facial hair. People with facial hair are more likely, that is a place where viral load accumulates. And so it may accumulate. Then you get past 1,000, you may get to 10,000, and then you whoosh, you suddenly wipe and you get a huge viral load. The other thing that we're seeing with people with facial hair is that their masks don't fit as well. So because the masks don't fit as well, then there's all sorts of holes for things to get in. I would absolutely get rid of facial hair while this is going on, and then you can grow it back after this is over.
Should we cover our hair?
You know, it's interesting. I do cover my hair at work. I don't cover my hair when I go out in public. But I do cover my hair at work where I'm in a setting where I run into COVID-19 more frequently. I do wash my hair more frequently. I probably wash my hair every other day, where normally I would wash my hair maybe once a week. And so, yeah, but that is an issue. If you're mainly at home and you're mainly just going out maybe for a nature walk or to the grocery store, you're probably okay. But if somebody coughed around me, I would absolutely come home and wash my hair.
Is it okay to crack the bedroom window at night or leave all
Absolutely.
the windows closed at times?
Yes. Fresh
Does
air.
it matter if you're near a development or a trash dump or,
No,
folks walk by?
Fresh air is good. So fresh air is good. Yeah, you want to open up your windows. You want to open up your doors. Any sort of ventilation or circulation with fresh air is actually really good.
All right, that's wonderful. Okay.
Yes.
All right. Can you give an example of how we can think about living with the vaccine in comparison to another disease that is similar that we might be able to wrap our minds around, that is the new normal? And is the rest of our year until the vaccine being diligent about surfaces, masks, and hand washing? Is that how we settle into this new normal?
Yeah. Let me see. I'm trying to think of, I would say vaccine wise, I don't know whether or not this is going to be a vaccine where we're going to get lifetime immunity. This could be a vaccine almost like the flu vaccine or the hepatitis vaccine, where every couple of years you have to get a booster. I would say as far as any disease that this is like, any sort of pandemic this is like, I would say probably the closest thing that is like is Ebola, or
Scary.
polio.
Okay.
Right.
None of
Those
that
are,
was good.
yeah.
Those were both very scary.
Yeah, probably those. Yeah, exactly. Yeah, no, it's probably most like those, because those are things where, when you look at like some of the other pandemics like malaria, yellow fever, those were all like mosquito driven, but this is more surfaces, right? And so, it'd be more like a Ebola or a polio.
Okay. The rest of the year being about, is that our new normal? Managing surfaces,
Yes.
hand
Yes,
washing.
absolutely. Absolutely, yes. So what's going to happen is, China shared with us the genome. China's doing testing, human testing, and we're doing human testing, and I think they're doing human testing in Europe. So when the vaccine comes out, and I suspect, so we were able to move faster on this because this is like SARS, and they had started actually working on a SARS vaccine when SARS came out. So because this virus is so much like SARS, that's how come we're able to move as fast as we're moving. And I know some people think, well, the vaccine's not moving that fast. No, this is moving fast, right? So if we get a vaccine out by, let's say the end of this year, then what they're going to do is they're going to immunize essential workers first. So they're going to immunize all the grocery store clerks, all of the transportation workers, all of the nurses, emergency department physicians, doctors, right, or dentists. All of those people are going to be immunized first. And then once they immunize essential workers, which will probably take them about 6 months, because they'll get us immunized quite rapidly. Like, we will get immunized while we're working a shift, right? Then they will actually begin, and they'll probably do those that are elderly or have some, or immunocompromised or have some underlying illness. So they'll go to people with the high risk factors, and they'll immunize all of those people, right? And then they will immunize sort of the general population. That's usually what they do. So I would suspect that, it's going to take, if we have a vaccine by the end of this year, it's going to take us all of next year for people to get vaccinated. And you'll see people who immunized probably go out earlier before people who are not immunized, obviously. You know what I mean? So,
is the vaccine even going to work? Dr. Fauci said he doesn't think it will.
Well, well, no, well, what he's saying is, let me just be clear. So those people who have gotten coronavirus, COVID-19, have shown that they can get reinfected. So just because you have antibodies doesn't mean you don't get it again. So you may get it again, but what happens is it's not as severe, right? So I wouldn't say necessarily that it's not going to work. So they are going to do what they call a human challenge study. And a human challenge means you have people who agree to get in contact with COVID-19. They actually agree to get the disease. They vaccinate them before, and then they expose them to the disease. That's what they call a human challenge test. So when the results of that come, then we'll actually really know.
All right.
But the question is, but how long do you have that immunity, right? You get that immunity for, so.
Parks and recreations are listed as low risk in your slide. Yes. So it's okay to sit on park benches. Should I spray first? And I'm actually going to add here any surfaces in the park. Like, how should we deal with those surfaces?
Yeah, any surfaces in the park, what I'm doing is I'm either, if I'm going to sit on them, I have gloves on, or I spray them.
Okay.
But in general, I don't sit. In general, me. But if I were to sit on them, I would actually sit on them and spray them. I'd spray them and then sit on them, or I would wear gloves.
My mom works for a school and is 65 plus. Mm-hmm. What can she do to protect herself? She works on a minibus for students with special needs. Oh yeah. Mm-hmm.
Oh yeah. So if your mom is works on a school bus with kids of special needs, she really needs to have either an N95 or an N100 mask. And that would be the most important thing for her to do. The N95 blocks out 95% of the particulate matter. The N100 blocks out 100% of the particulate matter. But when you're dealing with younger kids and you're dealing with special needs kids, they don't quite understand, not sneezing or not coughing or whatever. I would actually, if I was your mom, I'd actually, you can get them on eBay. You can buy yourself an N100 mask on eBay. It's a respirator mask. Let me actually show you. This is actually, let me show you. Can people see? Okay, all right, they can see. Okay, this is what it looks like. Okay, all right, just goes over your head, just goes over your mouth like that. This is what it looks like. So these cartridges, these filters here are changed. You can change these filters. So see, I have new filters here. Let me see here, new filters. So when I need them, and I just take this, we just take these off and you just put new filters on. But you breathe through these. This is much easier to breathe in than a mask. If I was your mom and I was over 65 and I worked on a bus, I'd get one of these. This cost me like, this was like maybe $80 or $90 on eBay or Amazon.
Right. So to that point also, I know some people have talked about wearing the mask and getting overheated. It gets hot under that mask. Are there some tips for how to manage that?
So this mask doesn't do that as much. This mask has much more of a ventilation on it, but your typical mask like this mask here, like this mask, these are much harder to wear, right? So these masks here, these you can get very, very hot. These you can get, and they breathe in and out. These are much, much more difficult to wear. I recommend wearing this type of mask if you just want to just get yourself something and just wear it. You find this is much easier to breathe in, right? So the type of mask that you get.
Recommend on the N100.
This one here is by Spirian. So this one here is Spirian. That I have. All right. And they come in small, medium, and large. And it's called a half mask face piece. That's what it's called. And it's a respirator mask. This is what I actually use.
Okay. So back to schools.
Okay.
Do you think schools are going to open in the fall without a vaccine?
I hope not.
Okay. Question related to coming out of California. California has prohibited wearing masks with a valve. Does that one have a valve? The N100.
They prohibited wearing a mask with a valve. They prohibited wearing, so this does not, so this is a, so this doesn't, no, this does not have a valve. This has a respirator component. It has a purifying respirator. It does not say it has a valve.
Okay, there we go. What do you think of the K95 masks from China that have been FDA approved?
Yeah, so the K95 and the N95 mask are essentially the same, right? But those masks are fine too. I have those too. I have a couple of those as well. The main thing is
mask everywhere.
I got a mask everywhere.
All
Yeah, if you want me, yeah, I've got masks all over the place. So the main thing is that those, you know, again, they block out 95. So a typical N95 mask or KN95 mask, right? In order for it to block out 95% of the particulate matter, you have to be fit tested for it. So most people have never been fit tested in their lives. So when you go to get a particular mask, if you haven't been fit tested for it, it's not necessarily working like it is actually supposed to work, right? So when you get fit tested for an N95 mask, then you know what kind of N95 mask you wear. It's similar to like, well, I might want a dress, but I have a dress in a size 10, 12, 14, 16, 8, 6, whatever, right? So my N95 mask that I've been fit tested for that works for me is an 1870 plus, right? So a lot of times people are just getting an N95 mask. They're not being fit tested for it, and they're not really getting the benefit of it. That's why I actually like this mask the best, because this comes in small, medium, and large, and you can fit test yourself. All you have to do is actually take these little things off, put your hand over it, and if you cannot breathe with your hand over it, you've been fit tested. That works for you. That's the size for you. Right? And so, but the other mask is much more complex to get fit tested. You have to go into a specific room, and they, you know, they send you some smells, and they determine, can you smell this? Can you smell that? It's a whole process. And so, I tell people, you know, to just go get an N95, to pay extra for an N95 mask and you haven't been fit tested for it is probably not worth it.
We have 2 more questions. I see it's at the 9 o'clock hour. Do you mind taking these last 2?
Not a problem.
Okay, let's do it. Unfortunately, do you feel it is safe to say we can count on an increase of infections this weekend, being that the beaches and parks are opening? And can we consider all of this to actually be a form of polluted air, given the nature of its behavior indoors and out?
So wait, where is this person? Where are you? Is he or she?
If I can find them, one moment, please.
Okay.
One moment. We'll see if we can get them live here. Oh, you have to get them live. Look for Keith Brown. I forgot I'm the co-host yet.
Oh, okay. All right. Keith, you want to unmute your Keith Brown or Kevin Brown?
I'm sorry, Kevin Brown. You're correct. Kevin Brown.
Kevin, you can unmute yourself.
Hey.
Hi. Okay. So where are you?
Jersey.
Jersey. Okay. All right. So you're concerned about are they relaxing everything in Jersey?
Yeah. This weekend.
Okay. No. All right. So I would be less concerned about the parks than I would be about like restaurants and things like that. So what's probably going to happen with places. So here's the thing is, when you relax and everybody reopens, you have to have the ability to actually test and actually know that your infections are going up, down, or staying the same. So if they don't have that ability, then what will happen is people will just start to get sick in a month.
Right.
And you'll know because they'll be like, oh my gosh, suddenly the hospital's overwhelmed and we have to shut down. That means they didn't have a very good monitoring system. If they have a good monitoring system, they'll shut down before people get sick. And they'll say, oh, we've been testing and the infection rate went up and we're going to have to shut down before people get sick. So I've been telling most people for this first round, don't relax. You need to do whatever you've been normally doing for at least 4 to 6 weeks after your particular jurisdiction opens up so that you can actually see what actually happens.
Yeah, that's scary.
Well, you have to wait it out. Yeah, you got to wait it out 4 to 6 weeks. And if you need to get a note from your doctor, get a note from your doctor so that you can continue to telework.
Okay, so they're like opening where they're able to, they say we're not able to congregate or whatever, but if hundreds of people come out to the same place, I mean, how could you avoid?
That's right.
You know?
No, that's why I'm telling people, that's why I'm specifically telling people go out in the morning. Do not go out in the middle of the day. Because I had the same thing happen to me. Like I went down to Haynes Point. I completely forgot that the cherry blossoms were out. There were all sorts of people down there. I was like, oh my gosh, let me get in my car, right? One day I went out on my trail in front of my house. It was Sunday at like noon or 1 o'clock. There were so many people on that trail. I scurried off the trail and got back home. And what I realized was I can't go out like that. You can't go out like that in the middle of the day. I got to go out in the morning. In the morning, I don't have any problems.
Well, let me ask you this question. Mm-hmm. With all those people gathering at the same place at the same time, it appears to me like it appears to me that the air quality will not be the greatest. Right. And does the air travel? So in other words, does that neighborhood become capable?
Well, so here's the thing is the droplets, the COVID-19 droplets that are in the air, they are heavy and they actually fall down to the ground, right?
But they say it could be in the air for 2 hours, 2 to 3 hours.
Correct. Well, I've heard about 15 to 20 minutes, right?
Okay.
I think a lot of it depends upon, so for instance, I got very upset when I went on the trail because there was a lot of bike riders and they were talking and zooming at 15 miles per hour. So If you already are talking and, because you talk, it comes out at 50 miles per hour. And then on top of it, you're riding your bike at 15 miles per hour. This stuff is like duplicative, right? And I'm like, oh my gosh, I got to get out of here, right? And so this is all why I say to people, if you can at all take your nature walk at 7:30, 8 o'clock in the morning, people haven't been on that trail for 4 or 5 hours, then you're good.
We're not talking about the nature walk. We're talking about an area where people reside, like down the block. So later we're going to be coming back. People are going to be suing those particular areas for having,
Oh, you mean like going to work? You mean going to work and coming back to work?
I'm talking about just being in the air, period, like traveling,
As you travel through spaces where there's been large congregations of people in the air.
That's how come I would wear my mask, and I really wouldn't go out for anything that I really didn't absolutely have to go out for. I know you don't want to hear that answer. but I really
you're talking about it's gonna get in your hair and all of that. This is not good. This is ugly.
No, it is. And I apologize for my dog. I gave him a bone and he has finished it. But no, I get it. I get it.
Yeah, it's not good. Thank you, Kevin. Let's go to the last question here, which is, if someone was sick in March and still hasn't gotten their sense of smell back, does that mean they are shedding the virus and are potentially contagious? Still shedding the virus.
Yeah. So very, very good question. So in Europe and China, those sorts of patients, they're testing them recurrently to see if they're still shedding viruses. We are not doing that here in the US. And so what happens is if you're in other countries and you're positive, then they continue to test you until you turn negative. We have seen stories of people who are positive and shed virus for a month afterwards. It may or may not be related to symptomatology, though. Some people are not symptomatic and they're still shedding virus. So yeah, that is part of the problem with our current testing. It is absolutely inadequate for this particular disease.
Dr. V, thank you again for bringing us this wonderful information. We don't always like the answers, but they're the answers that we need to hear to stay safe and keep our families safe. We appreciate you providing this. And I just want to remind our attendees that we do this every Tuesdays and Thursdays at 8 p.m. Eastern Time. So if you enjoyed this and you know someone in your life who needs to hear it, we invite you to share the information. And we will, it's Thursday today, so everyone should have a great weekend. And we'll be back on Tuesday at 8 p.m. Dr. V, why don't you close us out?
All right, thank you. And feel free to reach out to us on our website or on Twitter and put a plan in place for yourself and be diligent about it. And let's get on through it so we can get to the other side where there's treatments and vaccines. Thank you, guys.
Have a great evening.
Okay.